Sam, could you tell us a bit about your background working in the humanitarian sector, please, up until when you became the director of MSF Ireland?
Sure, yeah. Before I started work here in Dublin, I was working on communications and advocacy in the Middle East. So I was working on the Syria crisis based out of Jordan, but moving around a lot between Lebanon and Turkey and a bit in Iraq. Before that, I was working in communications for MSF in Japan, where I was the director of communications, and before that, I was a foreign correspondent.
All right. What papers did you work for?
I worked for news agencies. I worked for AFP, DPA, different news agencies in Vietnam and Nepal.
That's cool, yeah. Well, Médecins Sans Frontières is one of the most respected humanitarian organisations in the world. Could you tell me a bit about the history of the organisation and the rationale for it, and a bit about the countries you work in today?
Yeah, absolutely. Médecins Sans Frontières, MSF, was founded in 1971 in Paris by a bunch of doctors and journalists. And the idea was that we wanted to provide medical assistance to people that needed it, but also speak out about the situation that we saw. And we've been doing that now for more than 40 odd years. So today we've grown from a very small organisation to quite a large organisation. We have around 30,000 staff all over the world, mostly in national staff. We have a budget of around 1.6 billion euro at this stage, and we're working in around 70 countries, and we provide medical assistance to people who are suffering from the effects of conflict, from natural disasters, from epidemic diseases, and people who can't access healthcare.
How many countries are you working in today? And it's true to say, isn't it, that as you sometimes work in war zones, that your staff are at risk of death, aren't they, in these places?
There are security risks in some of the places we work, and we try to mitigate those risks. We try to address those risks. We're working in about 70 different countries. Around 60% of those would be in sub-Saharan Africa, so in the southern part of Africa. It's true that there are places like Afghanistan, Somalia, Syria, Iraq, that could be, that can be quite dangerous. But we also work in a lot of places that are not dangerous at all. So we just have to try and balance the risk and figure out how to work in the safest way possible.
Yeah, we haven't got the time today to talk in depth about all the countries you work in. If we can focus on two of the biggest countries in crisis, I understand that the crisis in the Mediterranean with the immigrants is getting a lot of coverage. But if we can talk about Yemen and the Central African republics, as the director of MSF in Ireland, what would you like our listeners to be made aware of as regards these two countries?
Well, I mean, there's plenty of ways that people can get involved in MSF by becoming donors or by becoming supporters. You can find out how to do that on our website, msf.ie. But in terms of what's happening at the moment, I think one of the things that concerns us most is what's happening in Yemen. You've got a conflict there that's been going on for more than 2 years. It's an extremely brutal conflict. It's very difficult for any organisation, including MSF, to work there. For several months now, there's been a massive cholera outbreak. There's been more than 400,000 patients. Many people dying in rural areas from cholera, and cholera is actually very, very easy to treat. But again, because of the insecurity, it can be quite a challenge to get there. And as you mentioned, Central African Republic, we just heard today there's 10,000 people sheltering in one of our hospitals because violence has just broken out there again. It's been an extremely difficult and challenging situation for MSF over the last few years, and more so for the people that are living there. But it's a very challenging context in which to work, and it's difficult for people in Ireland to understand. But as I say, you can find out more by having a look at the website.
And this might seem like a very simple question, but what is cholera?
Cholera is a waterborne disease that makes you vomit and have very bad diarrhea, basically. And basically it kills you within 24 hours because you get extremely dehydrated. It's very simple to treat. You just need to rehydrate people, basically. But if they can't get clean water, then it's impossible to rehydrate them.
For the last few years, Syria has been getting the headlines for the most dangerous country in a war at the moment. What's going on in Yemen, though, is a much greater problem, isn't it?
It's difficult to compare. I mean, the death tolls in both are very high. The death toll in Syria is much, much higher. But the thing is about Yemen is we just don't really know, because it's very difficult for journalists to get in there. MSF is supporting around 19 different hospitals. We're working in about 19 different facilities there. We've got several thousand staff, and what we're seeing is very worrying. But it's, Syria gets a lot of attention in the media, whereas Yemen doesn't. So it's difficult for people to understand what's going on. But from what our teams are seeing on the ground, the war, Yemen was already a very poor country that had lots of issues before this conflict. And the airstrikes, done mainly by the Saudi Arabian-led coalition, have really damaged life. And I was seeing reports today from other organisations saying that the airport being closed has led to the death of many people as well. So it's an extremely challenging situation in Yemen.
Yeah, I'm just talking about the scale of the number of people at risk of dying from hunger. It's unbelievable, isn't it?
I mean, in Yemen we're seeing certainly malnutrition, and that's because people haven't been paid their salaries for a long time. That's because in a conflict like Yemen, the price of goods has gone up, so the cost of living has gone up, so people can't afford to eat and stuff. I mean, we tend to, unlike other organisations, we tend to avoid using the word famine, but clearly there are severe malnutrition issues. Yeah.
What are the logistics of what support you need to be able to deal completely with all the casualties in these two countries?
I mean, when it comes to Syria and Yemen, the big question in terms of logistics is access. It's being able to get to these places. And unfortunately, in Syria, that's very difficult. We don't work in Islamic State group-controlled areas. We don't work in Government of Syria-controlled areas. We've asked for permission from the Government of Syria. They've not given it to us. Similarly, in Yemen, it's an active conflict, and if there's too much fighting, we simply can't go. So it's the main logistical issue is one of access. It's us being able to access people, and it's people being able to access health facilities.
So are you confident that if you did have access, that you'd have the resources to be on top of the situation?
Very much so. I mean, we're experienced in working in conflict zones for many decades now. We have highly trained professional staff, both Yemeni and international, but it's just a question of being able to work there safely.
Do the doctors of different specialities work with you, and do nurses as well?
Yeah, we offer a wide range of medical services, as wide as we can usually. That can include mental health, so we have psychologists, psychiatrists, mental health professionals working with us. We understand more and more that having good mental health is a key part of physical health. We do a wide range of medical activities. It's probably easier to talk about what we don't do. What we don't do is cancer, because it's extremely complicated and expensive. We don't do brain surgery, unfortunately, because again, it's extremely complicated. But we do all kinds of surgery: orthopedic surgery, plastic surgery, reconstructive surgery. We do all kind of preventative health care, whether that be giving people drugs for HIV or trying to work with TB. We work on all kinds of different epidemic diseases, on trauma injuries, on malnutrition. We don't do dentistry or eyesight, but other than that, we cover a wide range of medical activities.
To come towards the end of our interview, if there are any doctors and nurses listening to this interview who are interested in possibly registering with MSF and go abroad, what would you recommend?
Well, the first step, the most easy step, is to look at msf.ie, our website. We've got a very clear page on the website, a number of pages rather, that explain all the different specialities that we're looking for at the moment. We're not just, we are a medical organisation, but it's less than 50% of our staff are medical, because in order for those medics to do their work, we need logisticians, we need finance experts, we need administrators, we need water and sanitation experts, we need electricians, we need engineers, we need architects. So you can find all those different kinds of jobs on msf.ie.
And do your staff working abroad get paid?
Yep. They don't get paid. We do this out of what we call a spirit of volunteerism. So we don't get paid the market rates. We don't get paid as much as United Nations, or we don't get paid as much as you'd get paid doing the same job here. The starting salary would be around €800 a month, but that can rise to a couple of thousand. But people don't work for us for the money.
Finally, how can our listeners who don't work in the health sector or sectors that could help you, but how could our listeners support you and get in touch to support the organisation?
I think the easiest ways is through the website and the different social media channels. So through msf.ie, MSF Ireland on Twitter, MSF on Facebook. And the thing, even if people can't, donating money is one of the main ways that people can help us, and it doesn't have to be much. It can be €5 a month. I mean, what's important to us is that we have regular income. But if people can't afford to donate, then if they can follow the social media channels, if they can talk to their friends about the organisation, find out more about the organisation, and talk about our activities to their friends, that's more than we can ask of people.
Okay, Sam, it's great talking to you. I'll be talking to you again. Thanks very much.
Thanks, Darren.